Talk about the contraindications or cautions to the use of low molecular weight heparin. Okay, so low molecular weight heparin can be very easily compared to this dog, which is a domestic dog, was kept for help, but now it has turned wild, and now you have to be aware of it. Now, the beware conditions are those that we will be talking about in this video. Now, this dog can bite and cause bleed. When it is wild, it can bite and cause bleed. So, all the conditions where there is already bleeding happening, or conditions where the lady is prone to bleed, she has to be protected from this wild dog, because the dog will bite and it will cause bleed. So, conditions where there is a tendency to bleed or there is already bleed are the conditions where we will beware. So, now we will see what are those conditions. Now, it's very easy to remember that either she can bleed, that is, she has a tendency to bleed on the bite of the dog, or she is already bleeding. Okay. Now, already bleeding in a pregnant lady, what are the possibilities? Either it is an active antenatal or an active postpartum bleed. That is the two kind of bleeds which are possible in a pregnant lady. Either she's pregnant or she's delivered. So, this is something which is not very difficult to remember. Now, can bleed. Now, can bleed can be because of a lot of issues. Like this dog will bite and she will bleed all the more if she has a tendency to bleed. Now, we will think of the lady from her childhood. Yes, of course, she's pregnant, but she could have had some kind of proactive tendency to bleed from her childhood. So, maybe she has a bleeding disorder. Or in the pregnancy, we all know that she can have a placenta previa, or she could have an abruption. So, conditions where there can be antenatal bleeding. Okay. Now, another important factor in pregnancy is thrombocytopenia. The platelet count tends to fall. So, again, she has a tendency to bleed. Now, the platelet falls so much that it is less than 75,000. That means, again, she has a tendency to bleed. So, this dog can bite and cause bleeding. So, we will be aware of the dog. Now, suppose there are three organs, which in fact 4 organs, which we will talk about. One is the brain, one is the kidney, one is the liver, and another is hypertension. Okay. Now, when we're talking about the brain, suppose she had a ischemic stroke or she had a hemorrhagic stroke in the last 4 weeks, maybe. Now, if there was an hemorrhagic stroke, again she will bleed. The dog will bite and that stroke will bleed. Even an ischemic stroke, it can get converted into a hemorrhagic stroke if the bite is there. So basically, if there was a history of stroke in the last 4 weeks, then the dog will bite and cause bleeding. So beware. Now, the dog wants freedom. Any wild animal has to be set free. Now, if you don't allow the dog to go out, you block the exit. If you lock the door, again, that will make the dog all the more wild, isn't it? So, if you block the excretion of LMWH, if you block the excretion, if there is severe renal disease, the GFR is less than 30 per minute per 1.73 meters square, severe renal disease, the dog is blocked, cannot go out. It will create chaos. It will create chaos inside the house, isn't it? It's not able to go out. That means it will keep biting, biting and cause bleeding. Okay. Now coming on to the liver. We know that the antithrombin and the anti-10A levels will be affected when the liver is affected. So anticoagulation will be affected. So in those scenarios where the anticoagulants are affected, we all know known varices or conditions where the liver disease is affected. And we know 10A is what LMWH uses, isn't it? 10A is the food. Okay, now if you are playing with the dog's food, okay, then definitely again then the dog will again create ruckus. You are disturbing the food, you are disturbing the door. As it is, the dog is wild, so it will bite. Okay, so severe liver disease where the prothrombin time is above normal, that is severe. Definitely for which the prothrombin time is affected, and known varices, those cases again the dog will bite. So beware. And last but not the least, uncontrolled hypertension, that is a BP of more than 200 by 120. More than 200 by 120. This is again obvious that at this high BP, anywhere anything can rupture and cause bleeding. It is pretty high, isn't it? Now, on top of that, you have given a dog to bite. That will cause more bleeding. So again, a hypertension where the systolic is more than 200 or the diastolic is more than 120 can cause bleeding. So these are the simple contraindications for the use of low molecular weight heparin. We'll imagine a dog where you're disturbing its food, you're disturbing, it was a domestic dog, but now it is wild and it's not allowed to go out, and now it is biting the lady here and there, and she might be bleeding or she has a tendency to bleed. And in all those conditions, we will be aware of the dog. Thank you.